This is another case for our combo department, and again our combination department is what we refer to here in the laboratory. Anytime we're going to be doing a crown or bridge and a partial denture at the same time. And what we found over the years was if we had the crowns made in the crown and bridge department and then sent it to the removal department, sometimes they would complain about the guide planes or the rest prep. So we created a department that took some of the ceramists from the crown and bridge department and some of the technicians from the removable department so they could do both of them together and they could really fabricate crowns and bridges with the removable partial denture in mind to get better results. So this is an example where a doctor has prepped a crown, a tooth for a crown, and it's underneath one of the clasps that's there. And this is something we see pretty commonly where the doctor, for the pickup impression, then took a unilateral quadrant impression. And the impression's okay. The problematic part is more the fact that it's not a full arch. And so that's difficult for us to work with. In fact, if we put the partial back into the impression itself, or as close as I can get it in without forcing it in too much, we've now got the partial inside the pickup impression. But you can see when our technicians go to pour this up, we've got this whole free side over here where we haven't done anything with the pickup impression. And of course the stone's going to pour right out of here. So our great preference would be that you use a full arch impression anytime you do a pickup impression, assuming that the removable partial denture goes all the way across the arch and is in fact bilateral. So it's just always safer to go with a full arch impression. And so what our technicians did was just kind of made a little putty jig here, just something to kind of stick onto this so that we could pour this whole thing and actually end up with a model that kind of works. So we just took some impression putting, we pushed it against here, against the rest of this partial, and tried to kind of make a fake pickup impression, if you will, over on this other side, just so we could be able to pour a model. And so that's what we did, and we pour that model, and then we put the partial denture onto that. And so we can see that the partial was in fact seated correctly during that. You know, over on this side it's a little harder to verify because we didn't have that full arch pickup impression. So really anytime you do a pickup impression, we would love to see a full arch impression. As you look over here, you can see we can't quite verify that the clasps are in the right place in relation to those teeth because we just made those teeth out of putty so we could pour it and we had somewhere to pour it. But as we look at the preparation, we can see that we've got nice room and a nice amount of space between the facial and lingual clasps, and everything looks good. In fact, one of the things we're able to do now that we weren't able to do, say, 4 years ago, is on a case like this, the doctor has actually requested a Bruxer crown. And so this is a full contour zirconia crown, but when I put it into place and put the partial over it, we're able to use CAD/CAM to design these crowns, to design the guide planes, design the rest preps. And you can see that it actually, for us on the manufacturing side, is a little bit easier than working with a PFM. And the great news for the patient is anytime the partial's out, you know, or anytime, you know, beyond that, you can see there's no metal rest preps. So the rest preps are milled right into the zirconia itself, and so we're able to do a crown that does not have a metal occlusal. Obviously, you wouldn't think that too many patients would complain about a metal occlusal when they have all this metal with a partial denture, but you would be surprised, and I've certainly heard those complaints from patients as well. So one of the big breakthroughs for Bruxer is the ability to use it in a combination situation like this and then have a crown that doesn't have a metal occlusal. I realize when the partial's seated, there's metal on top of it, but there's nothing there, and it's a white tooth just in case the patient decides to stop wearing their partial for the rest of their life because it's uncomfortable or something like that. So really the takeaway lessons are two here. One, that we can do Bruxer crowns underneath partial dentures and they look really nice. And the second is anytime we do a pickup impression, please send us a full arch impression so we don't have to do this little putty matrix. It works, but it doesn't give us the highest degree of potential for restorative success when we send the case back to your office.